Hi, welcome to the Golden Years. I'm Lori Betts, and this month, February, is National Heart Month. So come on back. We are going to meet Lynn Rieg from the Cleveland Clinic.
You're watching The Bat.
Welcome back. My guest this month is Lynn Rieg, physical therapist from the Cleveland Clinic, and she is the outpatient regional manager. Lynn and I have been good friends for over 18 years. We go back to Medina General Hospital.
Yeah, I know.
You were one of my big accounts. I called on your department 2-3 times a week. And I've seen Lynn with the patients, with the seniors, and you do hands-on caring. So I asked Lynn to join us this month. She's going to tell us all about exercising. Ooh. And you're never too old to exercise, correct?
That is correct. Yes. Well, number one, thanks for having me. This is something I'm very passionate about, is exercise. And no, it's never too late to start exercise. With exercise, there was a research study done, and they went into a nursing home, and they wanted to answer that exact question. Is it too late to exercise? And they took a group of volunteers of 60, 70, 80, 90-year-olds, some on walkers, some with canes, some in wheelchairs, and said, okay, let's start an exercise program with them. So they did assessments, make sure that they were physically able to participate in that. They brought in some exercise equipment into the facility, and they looked at each person individually, and they said, okay, let's put you on an exercise fitness program. And in 8 weeks, they saw these people, of course you probably won't want to hear this, but they were getting rid of their canes, their walkers, their wheelchairs, and they were walking around the facility. They felt better, they had more energy. It's never too late to exercise.
That's good to hear. And they probably used that item as a crutch, and they thought it was an excuse. Okay, I'm using a cane, I'm using a walker, I'm in a wheelchair. I don't need to exercise anymore.
Exactly. Some of the people even got up behind their wheelchairs and were pushing them just in case they needed them to sit down, depending on how far they can go. And they found that they can go further and further. So absolutely.
Good for them. Good for
absolutely.
them. Okay, so should Mrs. Jones get her doctor's okay before she starts an exercise program?
Yes. Anytime before you start any fitness program of any sort, you want to get clearance from your doctor. There's a lot of different things. Everybody's unique, and people have different challenges that they face. So your doctor, your medical professional will actually give you clearance as far as what you can and can't do, and let you know, if you're physically able to, what type of exercise you're physically able to participate in. So it's always best before you start anything to get the clearance. And seniors, they're into seeing their doctors all the time. So it can just be, they could be in, for just an annual checkup, or they could be in for a follow-up visit, and it's just a quick question you can ask your doctor: can I start a physical fitness program? Which you always want to start slow in the beginning.
Definitely. And I tell a lot of people too, seniors, like, even if first thing in the morning, move that body. Do even like leg exercises or something before they remove themselves out of their bed. They've been laying for how many hours?
Once they get clearance to do something, the next best thing is to find out what your baseline level is and to find out what's the best type of exercise for you. But absolutely, laying in bed, sitting in a chair, laying on a couch is the worst thing for you. If I told you that I had a pill for you and that pill would improve your memory, you'll sleep better, your joints won't hurt as bad, you can decrease disease, reverse disease, you can feel younger, stronger, your balance will improve, your bone health will improve. Would you take it?
Heck yeah.
Guess what that pill's name is?
I bet you it's exercise.
It is exercise. It is exercise. And that, there's so many benefits to that, and people don't think they have time to do it. And that's where you just started. You know what? Before you get out of bed in the morning, or when you get out of bed in the morning, start something. And one thing about exercise, you have to make it a habit. Do you eat every day? Do you eat?
Every day.
Do you sleep?
More than once.
Do you sleep?
Yes.
You sleep? Okay. And some of us, or most of us, pay taxes. We have to do that. You know what? You have to incorporate exercise in your life. Some of the healthiest people are the ones that have incorporated exercise. And I've got some stories about some of my patients as far as, you know, my 60, 70, 80, 90-year-olds that are moving. And they come to see me because they don't want to stop moving. But you need to find your best time of day. And for, you know, different people, it's different times. Sometimes the first thing in the morning is not the best time for people. So maybe it's after they take their shower, or maybe they need a little energy, and so they have to get a granola bar, or they have to eat something first. What is the time of day that you feel the most energetic, and that's, or your best time of day, and then that's when you exercise. For me, if you had me exercising late at night, not my best time of day. My best time of day in the morning before I go to work. It's like, do something and start small. So exercise is definitely key. I have patients that, I had a 90-year-old patient come to me, and one of the questions that we ask when we're doing our assessments is, do you work? And I thought, oh, I'm not going to ask this little lady if she works. And I thought, oh, I might as well go through my list of things. And I said, okay, do you work? I thought maybe she might volunteer. She said, yes, I work. I said, oh, you volunteer? She says, no, I don't volunteer. I work. And she goes, I get a paycheck every week. I said, you do? She goes, I'm a custodian for a church. I love it. She goes, you got to fix my shoulder because I want to go back and I want to be that custodian.
How neat.
So, you know, so we were going to fix her shoulder. That was her motivation. I have, currently I have an 80-year-old. She loves to dance. She hurt her back. She's just like, you got to fix my back. You got to fix my back because I want to go back and dance. So we looked to see what she needed, and she's on her way. She's actually back dancing right now, but we're still working with her. And then I had another 84-year-old. She came to me, she goes, Lynn, I love to travel with the seniors. I want to go on my bus trips. I fell, I hurt my back, I need to get better. She said, she goes, you got to fix me. And so we looked to see where she was struggling, and she had trips planned to New Orleans, she had trips planned to Florida, and she wants to keep going, and she does volunteer work, and it keeps, and that's key. And she knew she couldn't stop exercise when she left me.
Well, you mentioned the one word, motivate. They have to motivate themselves to keep that body moving.
Absolutely, absolutely. You know what? The best thing is to find a goal. I had a 64-year-old woman come in the other day to see me, and she had a fall, and she said, you know what, I need to do something. I've just had 2 total knee replacements, and she said, I've got a brand new grandbaby. And she said, I want to be able to push that grandbaby in a stroller. I want to be able to hold that baby and not drop that baby. She said, otherwise I can just look at that baby from afar. My goal is to get stronger and better because I want to, that was her goal. She wants to take care of her grandbaby. So that was that lady's goal. I mean, like I just said, I had an 84-year-old. Her goal was to get on those senior trips and go traveling. She wasn't done yet. And then it might be a work goal. And people have little different bucket lists, you know. Don't give up on goals. What motivates you? And that usually can start an exercise program.
And when you mentioned dancing, my mother-in-law, 87, she was more active mentally and physically when she went polka dancing like twice a week. Now, that part of her life, she feels she doesn't want to be out at night driving that much anymore. God love her for that. But what a difference. What a difference in her. I mean, all she just wants to do now is like sleep and just do nothing. And it's like, man, do we need to be aggressive and take her dancing? I mean, because it's night and day, their attitudes.
And there is. And you know what? There's so many programs out there for seniors too. I'm thinking the Hands Foundation, and there's people that, you know, there's ways that people can get to doctor's appointments and get possibly to dancing. You know, I don't know what all those programs are, but I know that they're out there. And sometimes it's, you know what, don't stop what you love because of, you know, maybe night vision isn't the best thing. So, but a lot of people sometimes too, they'll stop doing what they have done because maybe they had a surgery, or maybe they hurt, or maybe they're taking a medicine that's making them more tired, and all of a sudden what they used to do has just changed them. And so that's another thing that you need to find what works for you. Sometimes people, their joint pain is so significant that working out on land is not appropriate for them, and getting in a pool and There are people who, my mother would be one of them who said, oh, she had almost a drowning experience when she was younger. She didn't want to get in the water at all. I said, Mom, you're not going to swim. So she wouldn't listen to me. And so then she went to the doctor, and the doctor said, you need to exercise, you need to get in a pool. So she was like 70 years old, so she goes and she tries, she works with a physical therapist, gets in the pool, learns some exercises. She loves it. It makes her feel good. It gives her more energy. She sleeps better at night. She loved getting in the pool, and she knows just walking along the perimeter of the pool in the shallow area, standing at the side, doing some leg lifts, doing some kicks. She feels great.
Good for her.
So,
and water therapy is supposed to be the best.
It's excellent for people who have arthritis. And there are a lot of senior programs and just aquatic therapy programs in general that are, I've seen them range from $3 a session to $6 a session, and most of them are located in your rec centers. And in those programs, they're very simple exercise where people are just moving their arms up and down. You're working against the buoyancy of the water, the resistance of the water. It's the buoyancy of the water supports your joints. It's the warmth of the water that also helps the joints. They're not feeling the pain.
I'm sure.
And they feel great. And not only that, is you're working out with other people who are enjoying what they're doing, and you build friendships. There's laughter, and it's just, everything about it's rewarding.
And time probably flies while they're in the pool.
The time flies. That's what I always tell people. Start small, and you just need to take that first step to find what you love. I mean, some people might need aquatic therapy. Some people might want to do, they like to golf. But, as we get older, our flexibility decreases. So you got to learn the right flexibility exercises. It's nice to get a fitness assessment prior to exercising so you know what exactly you need. But find something you love, because if you don't love it, if you think you're going to go to a gym and exercise, a lot of people don't like exercise. Find something you love and then vary it so that you don't get bored with it.
So do you suggest, like the senior, well, I know a lot of them are in the home, they're confined in the home. Is it better to go out into a group and exercise, or just start a program at home and stick to it?
You can do lots of different things. It depends what's convenient for you. To get out and exercise and to get into a rec center, you'll develop friendships. I always used to tell my father, he's 85 years old, and he'd go to the rec center and work out, and I said, I think this muscle right here worked more than anything else, but you know what? He worked other muscles too, and the thing is that he got stronger. It supported his back, and it really helped him. So he enjoyed the rec center. But there's other people who can't get up and go. They don't have the car available to them. So what I suggest always is put exercise equipment, if you have it, where it's convenient. Take that bike that you've used for a clothes hanger and put it in front of your TV. And you know what? Instead of sitting on your couch and watching TV, get on that bike, 5 minutes, start small. Don't make these lofty goals and say, okay, tomorrow I'm going to exercise 30 minutes, because you're not going to want to do it. Get on that bike for 5 minutes, or get on that treadmill for 5 minutes. Or take a weight that you have right by your couch, make sure they're convenient for you wherever you go, and pick up that weight, and you're going to do a bicep curl, maybe then you'll do the other one, and then maybe you'll do an overhead press. Before you know it, you've got 5 minutes of exercise done. All of a sudden your energy level's increasing, and then you want to do more, and you end up doing more. You do 5 minutes on a bike, once you get that 5 minutes is done in a blink. Then all of a sudden it's like, oh, I could do 5 more. Then your energy's getting more, you're getting more and more energy, and then you go to 10. And there's lots of different equipment. If you're in a nursing home, they have equipment that you can go down. They have recreational therapy, and those are different activities that they can get into. But you don't even have to have equipment. You can use, and I think we're going to show a little bit later.
After our break, we're going to come back, and you're going to show us some exercises.
Simple stuff that you don't even have to have equipment for, that you can use at home. So it depends on what's convenient for you. Getting out's great. Walking, cheap, great. You want to do it safely. Getting with a friend, that motivates you even more, because now you're a team and you work. So it depends what you have. If you're in an apartment building like United Labor Towers, you know what? There's people within the building. Find someone, say, hey, let's walk the hallway. Well, now let's walk both flights. And you'll find
definitely,
different. You've got to find what works for you.
And a lot of people after surgery, and I really believe when they come into the store and they say the surgery went wrong, you really can't blame the doctor, because a lot of people do not take the time to faithfully do the exercises. You are your own policeman. You have to say, okay, I want to do the range of motion again. I want to be back to feeling good and no pain.
Absolutely. You're not going to get better by laying in bed. One of the best things that you can do is exercise before your surgery. And a lot of programs right now, whether it's a total knee replacement, total hip replacement, physicians are recommending that you get an exercise program, very simple exercise program, to start before you go into surgery, because those patients fare better. Those are the ones that are up and walking and their rehab is shorter when they've exercised before. But you're absolutely correct, and there's simple exercises that you're given a handout for that you can do. You can do laying in your bed, some of them, and one is standing at your kitchen counter as others. But just getting those muscles strong before you go in for surgery and then keeping it up after surgery.
Yeah. Don't baby yourself.
Don't baby yourself. No.
Get your
no.
muscles moving.
That's right.
Okay, we're going to take a quick break, and then Lynn's going to come back, and I think we're going to do some exercises, easy exercises. Come on back.
Scam artists are trying to trick seniors into giving them their Medicare numbers.
I heard that, and I did something about it. I joined the Senior Medicare Patrol, where I teach others to protect their Medicare numbers, review statements to spot false charges, and report fraud.
Dad, you've been my inspiration. And Mom, I miss you so much.
Type 2 diabetes steals the lives we cherish most. Are you at risk?
Welcome back. We're interviewing physical therapist Lynn Rieg from the Cleveland Clinic, and we are going to get into some exercises. And not every exercise program needs the big expensive equipment. Lynn's going to give us some tips on easy things you could do right at home in your chair.
Okay, that's right, Lori. You don't have to have exercise equipment. You don't have to leave your house in order to get fit and to get stronger and to feel better. So, simple thing, most people have a chair, and especially
with arms.
With arms, most people do. And one of the things to work on the legs and the hips is a chair. And most people, they're sitting back in their chairs, and when they go to get up, they're always using their arms. And they do that for safety. And as therapists, we tell people, as far as safety is concerned, make sure, you use your arms to press up. And then just, over time, we start using our arms to push up. But what happens is our legs get weaker and our hips get weaker because we start relying on our arms. So number one, if you want to work on your arms and work on an arm exercise, of course, you have to make sure your shoulders aren't hurting, and this would be something you have to watch with arthritis. But you could do a simple exercise just up and down with your arms, and you're working the entire shoulder musculature and your arms. Then another way, and I'll have you do this too, is try to get up out of a chair with your hands on your legs to start, and see if you can come up. And then sit back down, and then come up. And as you do that, try to keep your knees behind your toes. All right, that is very difficult for a lot of my seniors to do. So I tell them to start with either a higher chair or get a pillow or a cushion from their couch and sit down safely and hands here and come up. And once this is easy to come up with your hands here, try one hand here. And once that's easy, don't use your hands at all and come up. Your turn.
Easier said than done.
Not too hard, not too difficult.
Easy.
So start sometimes with a higher chair or with a pillow in your chair or a cushion in your chair, and then as you want to progress with exercise, as you get stronger, because you will, take that cushion out and try to get up from here. So there's two simple exercises, one with the arm.
And you could do this while you're watching TV.
You can do this while you're watching TV, exactly. And if you want to make it a little harder, but this is usually a little too hard for my seniors. But if you can, You don't sit down. You get up, you just touch the cushion, and you get up and down. That really works the legs. Want to try that one? Feel that work in your legs, your thighs, your bottom?
I feel the pounds just shedding right away.
There you go. Then that same little chair, you can come behind, and you can use it, or you can use the counter of your kitchen counter, or you can, we've got the fireplace here, and you can use that ledge, but you can come behind. I always tell my seniors to get really close to their counter so they don't cheat. And you can bring your leg out to the side. And this is great for balance and for strengthening the hip because you're standing on one leg, but hold on to your kitchen counter. As you get better, you're not going to need, you may only need one hand on the kitchen counter to do that. Then I say try fingertips on the kitchen counter, and then you do the other side. And you want to work up to about 20 repetitions. And anytime you do a strength training program, which is what I'm showing you right here, 2 to 3 times a week. No more than 20 repetitions. Then, after we do that, I tell them to bring the leg out to behind them. So I don't know. I'm going to turn the chair and bring the leg out behind. But what I get a lot with my seniors is they do this because they don't have the flexibility in their hips because they're sitting a lot. So I tell them really try to focus, keep your belly up to the counter, up to the chair, and bring your leg back. And then they can do marches. You can march one leg, you can march 2 legs. Again, you're still standing on one leg and you're building, a balance is really important with our seniors. And you can also do heel raises. And what's usually really tough for seniors is to do toe raises, but it's possible to do that too. So you put your hands up against the wall and you can do a wall push-up. Easy. Again, don't want to do more than 20. Feel that energy just flowing?
Good tips, really good tips.
If you have exercise equipment, I always say keep it close. Keep it in a room that you know that you have the opportunity to exercise in. For women, at the senior level, don't use more than 2 to 5 pounds. Men, anywhere from 7 to 10. 10 would be the most you'd want to use. You can use weights, you can use TheraBands, and there's some really easy exercises. You can sit in your chair.
You want these?
Yeah, we can use, all right. You want to use those? No?
They're a little heavy for me.
But you can do it in your chair. And you can sit there and you can do one arm at a time, bicep curl. You can change it up. Your palms are up here, palms are in. Bicep curl this way, get in a different part of the bicep. Then you can lift those arms up, get part of the shoulder. And then you can lift them out to the side. I'm going to move over so you don't hit me. And then you can come this way, lifting that part of working the shoulder again. And then you can do an overhead press. And you're sitting, and it's simple. So those are some things to do.
Great
You
tips.
can also do all that without weights. And then there's TheraBands. With this, I always tell people, if you can, step on it. You can do,
I got to step on it.
got to step on it. Don't do that.
These are not the right shoes.
No.
Okay.
Okay. There you go. You can step on one foot. Okay. Now, palms up. Elbows at your side. Lock them in. Okay. And then you just curl up. That works the bicep. Easy.
These
Then-
TheraBands come in different strengths, different colors.
Yes, they do. Good question. Great question. So you want to start off small with the lightest weight and the lightest resistance with your TheraBands. But then you can also take it, step on it again, and you can just push overhead. Just pushing up like you're punching up.
I'm watching you.
You're looking like... Yeah, it's not going to help you just by watching. And if your resistance bands are, if they're light enough, you can actually, and I don't know if I can do this with the shoes I have on here today, maybe, but you can take your bands in your hands this way and you can push up overhead. So you don't need any fancy exercise equipment.
What do you want to leave the viewers with? Tips for the seniors.
Some, just to sum this all up, the first thing you want to do is you want to get a release from your physician or your medical practitioner. What's nice is if you can get a fitness assessment, see where your baseline is, see how flexible you are, see how strong you are, see what your cardiac health looks like, what your aerobic capacity is. Third is to set goals. Is make sure that do something that, find something that you want to do and you want to achieve. You know, I want to go whitewater raft the Grand Canyon someday.
Go girl.
Okay. So I want to stay fit so I can do that. And hopefully I can do that with my sons, you know, who are 15 and 22. You know, that would be...
And you could keep up with them.
I want to keep up with them. That's right. And someday in the future, probably grandchildren. I want to be able to keep up with them too. So you've got to set goals. And one, make it a fitness goal. Like, okay, tomorrow I am going to do 5 minutes of exercise. Then next week, I'm going to do 10. The next week, you know, 15. Then increase it. You'll find that you'll reach those goals faster than that. But definitely set goals, a fitness goal. I'm going to do 5 minutes of an aerobic exercise, whether it's just walking or on the bike, or I'm going to do 5 minutes of strength training the next day. I'm just going to pick up a weight and do it. I'm going to put exercise equipment where it's convenient for me. You want to set a strength goal. So if you're strength training, you want to say, you know, I'm going to start with no weights, then I want to start with maybe 2 pounds, 1 pound, 2 pounds. You can work with a can of soup. Then, yeah, you don't have to go and get weights. And then you want to make
certain flavor?
And pick your favorite flavor. Yes, that might motivate you. And then you want to set an aerobic goal for your cardiovascular health, and so that so that I was just thinking of a saying that somebody told me: if you don't take time for exercise, you will need to someday take time for illness. You want to make an aerobic goal, so you want to do 5 minutes on a bike, or 5 minutes of aquatic therapy, or you want to do a 5-minute walk, something that's simple. And you want to make sure you're properly hydrated. As you age, you know, you always feel like you're going to the bathroom all the time, and you want to make sure that you've got enough liquids in your body. Every time you pass a sink, take a small glass of water. You might tell me, oh, well, I'll be in the bathroom all the time. Well, yeah, here's another physical therapy tip that we get into, but you know what, as far as the less water you drink, the smaller your bladder will get. So when you start to drink a little bit more water, your bladder's not holding as much, you're into that bathroom right away. So if you can retrain your bladder to hold more and more water by taking those little extra drinks a day, you'll be able to go longer with not having to go to the bathroom. It takes about a month to retrain the bladder. So that's just a side.
Good tip. Very good tip.
So make sure you're properly hydrated, because it'll increase your memory, boost your energy level, and don't avoid the water. You know, if you want to have proper diet, so make sure that one of the best tips I ever got from a doctor is she had said, you know what, our bodies weren't made to really process the preservatives, the foods with preservatives. She goes, go around, you should only buy your foods from the outside perimeter of a grocery store. She goes, because those are the foods from the earth. Those are your vegetables, your milk, your meats, everything along the outside perimeter. That's where you need to buy your foods. That's what your body can digest and process. Check with your doctor, because there might be medications and foods that you can't eat together. A vitamin supplement's always nice. Again, check with your doctor, because if you're on a blood thinner, you don't want to be taking vitamin E, you know. So you want to make sure you check with your doctor and say, hey, these are the vitamins I'm thinking about taking. This is the medication I'm on. You know, what's appropriate for me, because we're never going to get enough vitamins in our food.
Body's forever changing.
It is always changing, and you just need to make exercise a habit. I asked you if you slept. I asked you if you ate. You need to incorporate exercise. You know, you're going to take 20 or 30 minutes to eat. You're going to take hopefully at least 6 hours to sleep. That doesn't always happen, but that would be a healthy rest. But you want to take time for exercise. Start small. You'll feel a lot more energetic. You'll feel better. And make goals. Thanks for having me.
And you have great tips, and I hope the seniors out there will take your advice.
I hope so too.
Come back next month. We are going to be at Plum Creek Assisted Living.